Hi everyone, welcome to this course unit on Fundamentals 4 of Nursing, unit code BMS 2211. We're going to look at basic life support as part of our continued series of lectures. Welcome everybody. And my name is Samuel Mungai Mbugo, and I'll be taking you through this course today. So, honored as we begin, we want to define the ages in which we look at when we think about basic life support, our demographics in terms of which patients we need to focus on. And it's important because, as we've mentioned previously in our class, that basic life support is tailor-made based on a particular age set. For example, infants, anyone from 0 to 1 year, they have specific difficulties, specific deficiencies that we need to focus on every time we think about first aid, basic life support upon this age group. Then we have children, anyone from 1 year to 7 years. We have adults, 7 years and above. So today we were going to specifically look at adult basic life support. All right? So let's quickly go back to the chain of survival. What do we focus on around the four circles here? Beginning with when you first get to the site of an emergency, an accident at home, it could be in a workplace, it could be at school. So our first point of contact is here. You think about prevention of cardiac arrest, right? Early recognition of danger signs, and are you able to call for assistance, call for help, people to assist you with this, right? So you focus on who can best assist you. The most probable person is the person nearest to the site of the accident or the site of an emergency. The second cycle is early CPR, early cardiopulmonary resuscitation to assist with buying you a bit of time. Are you able to buy time, sustain life before the patient gets to where they can get help in a health facility, in a hospital? The third circle involves about, our key focus, our organ of pumping blood, right? The heart. How best can we sustain cardiac activity? And that involves defibrillation. If in case there's a trained medical provider, trained health provider, are they able to come on board, use a portable defibrillator to restart the heart in case there's cardiopulmonary arrest? The fourth circle involves post-resuscitation. What happens after the patient has been resuscitated? All right? So it involves restoration of the quality of life, involves IV fluids. Can you maintain life? Can life be sustained and ensure that the patient goes back to normal body functioning? Right, so that's our chain of survival. And every time we think about emergency, we think about first aid, we think about basic life support, it involves following this chain of survival to the last circle here, post-resuscitative care, or ensuring and restoration of quality of life. So our action plan involves 4 aspects, and we shall begin with danger. What is the cause of the mass accident? What is going on, or what has resulted in the cause of bodily harm to patients or to your clients as a first responder? So always assess the situation for the danger. First, to you as the first responder, to the bystanders around, people, at the scene of the accident. It could be in a factory. Who are these bystanders? And human beings are always prone to always running towards danger first until you experience the calamity or the dangerous event, then you run away from. So, danger to you, bystanders, or even the casualty, or the person who has been afflicted here. Then, always watch out for other sources of danger. For example, cars, people. fire, gas, and even electrical lines, which is very common in our setups, right? And then any other potential hazards. Always be on the lookout for these events, because you could respond to the site where, you know, there was a mass accident, and then you're not aware of leaking gas or leaking fuel. Next thing, someone ignites the fuel. Like, point in case what happens with a lot of accidents that happen on our major highways involving fuel tankers, for example. Responders get there, they're trying to help the people who've been injured. People are trying to siphon fuel, for example. Next thing, someone lights a cigarette, and boom, you have a bigger catastrophe than what you expected. Right, so always assess for the danger and what you can do about, say, danger. Response, very important, right? And this, I said, is part of a cascade of 4 key components of action plan. Danger, response now. So response is the person able to respond to various prompts? It could be verbal prompts, it could be tactile prompts, it could be, you know, painful stimuli. So always ask, right? Ask, hello, are you okay? Command, even. Excuse me, sir, do this and this. You know, you issue a command because in case of an accident, you are the key responder. You are the main person at this site. You're supposed to dictate the chain of events that follows after. Then shake in case someone is non-respondent. Right? Vigorously, not so vigorously, that is. Just, you know, shake them. Ask them, excuse me, are you able to respond? Can you, you know, basically follow a few commands that you give them? Then, so here, when you think about response, as we've mentioned before, AVPU is our directive, and it serves as sort of a way of alerting people, alerting you. So first you assess for how alert is the patient. Can they respond to voice commands, voice prompts? Are they responsive to pain stimuli? And pain doesn't mean you have to prick them. You can, you know, just apply gentle pressure on specific parts of their tissue. Or are they genuinely unresponsive? And this again goes to sort of help you understand the Glasgow Coma scale. Out of 15, how best can this person respond to various stimuli? How alert are they? Right? Reaction to light, voice commands, pain, and are they totally unresponsive? Right, so moving on. So as we check for response, in the AVPU, alertness, verbal or voice commands, pain stimuli, are they unresponsive in totally? As we look at this cascade of events, always shake the shoulders gently of the client. You know, hello, are you alert? Are you awake? Do you understand what I'm saying? Right? Ask loudly, are you all right? To understand how badly or how well are they doing. Okay? And always think about triage when you're thinking about basic life support. Okay? Basic life support helps you to attend to the casualty specifically, while triage helps you look at the bigger scenario. Who requires urgent care immediately? Who requires urgent care? You know, probably you can give yourself 30 minutes to attend to the most immediate or most severe cases, and then those who probably would, you know, could actually get to a hospital to seek further care. Right, so if a person responds, leave them as you found them. Right? They are responsive, they are alert. Find out what is wrong. Assess. Now this is where you do a quick physical assessment, find out what exactly is the problem. Is it respiratory? Is it physical trauma? Is it head trauma? Right? So this requires a quick assessment. Reassess regularly, after every 30 minutes, 15 minutes thereabout. And always, if the person does not respond, if they're unresponsive, please shout for help. Because now this person is probably at the top, right? It's a priority person in your sort of triage process. Right, so let's look at the airway. Very important as you think about basic life support. Now, as you will see later on, basic life support sort of is different. When you think about the ABCs, when you're thinking about resuscitation, you think about the airway, you think about breathing, you think about circulation, and then any other conditions that might present. But here, we start with circulation when you're thinking about basic life support. So focus on the heart first. Focus on, is the blood flowing? Because that is one of the key vital systems. Circulatory, cardiovascular system. Right, so airway, respiratory now. Always, if the person requires some sort of breathing assistance, all right, to clear the airway, always use the head, tilt, chin, lift maneuver. And this gentleman here is a first responder. He's showing exactly what you should do. Now, the head, tilt, chin, lift maneuver essentially means that if the person is lying down, remember, most importantly, when you're thinking about, basic life support, first aid, supine position is the position in which your client should be in. So in the head, tilt, chin, lift maneuver, you place the person or place one hand on the patient's forehead, sort of as a support, right? And then at the base, if you feel the bony structure, the mandible at the tip here, right? Lift it up gently, all right? And then sort of that helps you to clear the airway. Clear the airway and ensure that the tongue is not causing obstruction. We're together. So, but if you suspect spinal injury, then do not use the head tilt chin lift maneuver because it might cause injury to the cervical spine. Right? So, what do you do in case you suspect spinal injury? It's you have arrived at the scene of a road traffic accident. Common here is you'll find a lot of spinal injuries associated with road traffic accidents. It could be between a car and a motorbike, it could be between two cars. Always, please, if you suspect physical trauma, spinal injury could be a likelihood. So, what do you do in case you suspect spinal injury? Jaw thrust technique. Please note, not the head chin lift tilt maneuver, Jaw thrust technique if you suspect spinal injury. And what does that mean? Place both hands, right, on either sides of the face, such as this. This gentleman is clearly showing that. Now, with the tips of your fingertips, gently lift the jaw open. Just gently, sort of like this. It's like you're yanking out or opening the lid of a container. Gently. But do not tilt the casualty's head. Together. That is if you suspect this. Spinal injury. Gently, just opening it will help you to clear the airway and there will be no obstruction from the tongue. Okay, breathing. We're moving on to, you've ascertained, you've cleared the airway. Now, how do you help the patient to breathe? Important. Look, visualize. Always, please ensure that all your senses are alert, especially your sense of sight. Are you able to see what's around you? Remember, we began by ruling out danger. Now, I want you to think about looking. Look at the patient. Look at the casualty. Listen and feel for breathing. Okay? Vision or inspection, for example, observation even. Listen. Just listen, for any crackers. Right? Feel for breathing. Can you feel the breath sounds and so forth? Then, if there's no breathing, give 2 artificial ventilations. 2 artificial ventilations, right, for every 30 compressions. Now, we'll look at compressions shortly. So remember, ventilation is given for 1 ventilation every 5 seconds. such as this person is doing. Remember, he has lifted the chin like this to clear the airway and assist in flow of air down into the lungs. This could be a complication now if you're thinking about, social distancing, COVID-19 and all that, right? But as a first responder, these are the essentials. Other forms of ventilation, assisting you to propel air into the lungs, right? So this is when you use a sort of assistive device, okay? And this person is then able to blow air nicely into the person. And remember, this is a face mask. Look at it. It's able to focus air into the nostrils. Then we have this technique here where you use a number bag with assisted ventilation here. And this is ventilation in case someone has a stoma, right? A stoma is, a creation of an extension here into the airway to help with respiration. All right? So those are other types or other forms of ventilation. Then we have circulation. We'll focus on, is the person able to circulate air? So check or even palpate the carotid artery here. Most accessible. If you're thinking about, the person you've cleared the airway, you've helped with ventilation, you want to check for circulation, carotid artery. And it is as I am showing you here, okay? Sort of on the lateral aspect, on the upper portion of the neck. Check for the rate, the rhythm, and the strength of the pulse. If absent, think about chest compressions. And remember, this is adult basic life support. 30 compressions for every 2 ventilations in 1 minute. Locate the heart, okay? And then compressions are usually approximately 2 inch deep or a third of the chest, 5 to 6 centimeters. The normal rate that you want to focus on is usually 100 sort of beats per minute. So when you're given compressions, first locate the position of the heart and always ensure that your compressions are 2 inches deep, a third of the chest. Are we together? So this is best shown in the next diagram, chest compressions. Remember, we discussed this earlier. Always kneel down next to the patient, okay? Do not use the palmar surface, but use the heel here. Are we together? So, one hand, your active hand is always on top, and then use it to guide the compressions, the ventilations, at a depth of about 5 to 6 centimeters. Supine position of your client. We've covered the ABCs of cardiopulmonary resuscitation. Airway is cleared, breathing. Now circulation to sort of help the heart perform its pumping. Action, to ensure that there's circulation of blood to all the vital systems. So, look keenly, and always as you conduct compressions, chest compressions, please be on the lookout for any other complications that might present. Okay? You could notice that probably the person has a pneumothorax, which would then present a challenge for you because you need to ensure that the chest compressions actually deliver oxygen to the lungs. And a pneumothorax causes sort of a restrictiveness to this. So, chest compressions, be very keen when you're looking at this. CPR for 2 minutes, cardiopulmonary resuscitation for 2 minutes. Remember, 2 ventilations, 30 compressions. Total of 5 cycles in about 2 minutes. Then reassess. Reassess for signs of cardiac activity, signs of breathing, respiration, right? Assess for pulse, circulation. Basically, vital signs away from temperature and all that. Then, very important, and this is sort of repetitive when you think about first aid, when you think about basic life support, always call for help. Get help. Continue with CPR while awaiting for help. Please don't say, okay, we've gone through CPR, we've done CPR for 2 minutes, we're done. No. Ensure that you continue calling for help. All right. So, in summary, what are we saying? Sort of, we call it DRAB, acronym DRAB. Danger. Check for signs of danger. Remove any causes of danger around that might result in further injury to yourself, to your casualty, to bystanders, and so forth. Response of the client. Ask, command, and shake. Check for alertness, right? Alertness. Verbal command. Are they able to respond to verbal command? Check for response to painful stimuli. Check or assess if they're totally unresponsive. Just the yes. Please always remember that. Airway. Always ensure that the airway is open and maintained, right? The maneuvers we've talked about. Breathing. If it's absent, right, this is when you're thinking about, now we need to resuscitate this person. In absence of breathing, 2 ventilations, and if circulation is present, give 10 ventilations. If you have ascertained that there is cardiac activity and circulation is ensured. In absence, again, of breathing, with no circulation, no cardiac activity, 30 compressions with 2 ventilations, remember, for about 5 cycles. 2 minutes to 2.5 minutes, so that means. And remember to call for help. As you call for help, reassess in about 2 minutes. If you reassess, then again look at danger, response, airway, and breathing. Why do you need to keep checking for danger? The situation could change, right? It could be someone probably had cardiopulmonary arrest, heart attack, somewhere where they were hiking. And then you're there, you're a first responder, you're trying to resuscitate your client. Next thing, a lion shows up. That's a cause of danger. Scenario has changed. New measures need to be put in place. So always check and remove any additional causes of danger. Modifications to the current approach. Remember, ABCs is what you've gone through. Airway, breathing, circulation. This is what I mentioned earlier. There are sort of modifications. Instead of beginning with the airway, breathing, circulation approach, begin with circulation first, chest compressions, then the airway, followed by breathing. Right? What is the aim of this? Circulation, very important. Ensure that there's perfusion of vital organs, that is the brain and the heart. Remember what you've covered in physiology and anatomy. Key organ that requires essential blood supply more than any other organ is the brain. So, it's important to ensure that the brain is perfused, to ensure that you're not resuscitating and the patient is in a vegetative state. So, first, ensure that there's perfusion to essential organs, first, without any delay. Very important. I feel like that should be highlighted in red. Right. What happens, or when is CPR, cardiopulmonary resuscitation, when is it not needed? So, if you have checked for the danger and removed it, if you've checked for response, and there's response, if the airway is maintained, it's open, breathing is present, then place your client in a recovery position. Very important now is we want to look at what is this recovery position. Now, before we go to that, when do you stop CPR? When do you stop resuscitative measures? If the patient starts coughing, right, they're trying to clear the airway. If they open their eyes, they start speaking, they're able to say, hey, okay, whew, that was a lot. They're able to talk now. They move purposefully. There's purposeful movements, right? Then we have breathing. Can they breathe normally? If you have ensured that the patient is able to respire, as they always do, then you can stop cardiopulmonary resuscitative measures. If it's more than one rescuer, if additional help comes and you're two rescuers, right, to ensure that on one rescuer does not get too tired, you can exchange. Change the rescuer, resuscitator every probably 1 to 2 minutes to prevent fatigue. Avoid any delays during a changeover. Don't interrupt chest compressions. Very important. Now let's talk about this recovery position quickly, yeah? Before we finish. An unconscious casualty who is breathing and has pulse should be put in recovery position as indicated here. Okay? Now let's quickly look, how do you do that? 4 quick steps, okay? Raise the person's right hand, that's the right hand, and the other one is on the side. While in a supine position, put the left hand on the cheek as such, right? With the right hand still sort of flexed but raised a little bit. Then take the left leg, okay? Fold it, flex it a little bit, and then turn the patient to lie laterally with the right leg extended, left leg flexed. All right? So every time you think about recovery position, every time you think about, okay, we've conducted CPR, cardiopulmonary resuscitation, we've ensured the circulation is breathing, the person is able to perfuse the vital organs, the brain, the heart. So once the brain is perfused, the heart is able to pump blood to the rest of the systemic circulation, then, you know, essentially your work as a first rescuer for that person is probably, you can say, 60% done, because you still need to get the person to a health facility. And remember, complications arise every time, all right, depending on what is the cause of the event, of the casualty, getting into an emergency state. So put the patient in recovery position as you attend to other cases that might present. So remember, DRAB, danger, response, airway, breathing. And when you think about response, think about AVPU, alertness of your client, response to verbal stimuli, response to painful stimuli, and are they totally unresponsive? Right? So these are the key concepts when you think about adult basic life support. And don't forget what we covered. What are the differences between adult, infants, basic life support? All right? And so as I conclude, I want you people to go back, read about advanced life support. That comes after this. It should be a focus. If you can start reading early, it would really help you as you move along, as you think about first aid and what measures you can take in case you're in case you're a responder. Remember, there are 2 responders, 2 basic types, right? There is a bystander who can help you immensely, especially when you're trying to look for help. There is a rescuer, a layman rescuer, which doesn't mean they don't know what they're doing, but they can go a long way to helping you with the whole resuscitative measures. And then we have a trained rescuer who is able to use other devices like a defibrillator and so forth. So that marks the end of this short lecture, but remember to read a lot, read more, think about first aid from where we began. What are the roles, the principles of first aid, the roles of a first aider? How does that sort of help you target which patients need essential first aid care immediately? And this is just to give you a picture of triage. Then the whole basic life support approach, from ruling out danger to alertness to responsiveness, that is airway, and ensuring breathing is taken on. And once this is done, remember to always put all your clients in a recovery position. Right, so read more, and I hope to interact with you more in further sessions. Thank you very much.
These televised lectures supplement our robust online learning going on our MKU online platform. You can view more on our televised lectures via our online platform. We are in a digital era, and Mount Kenya University knows this. The following are the steps to follow so as to complete your online application. Download the application form from the website www.mku.ac.ke. Attach copies of your academic certificates and ID. Pay the application fees via M-Pesa pay bill number 270988. Your ID is the account number. 2,000 shillings is the charge for a postgraduate. You can also deposit in the bank accounts provided on the website. Then email all the above to apply@mku.ac.ke.